Hello guys, welcome back to the another video tutorial from Dr. TI Lectures, and this is the second part of the video lecture, the diabetes. We discussed some important types of diabetes. We discuss important conditions in diabetes, what happens and how insulin hormone is responsible for overall this process of diabetes, right? So in this video lecture we'll discuss about the signs and symptoms of this disease, and importantly we'll discuss the preventive measures, right? So if we talk about the signs and symptoms of this disease, as we know, we talked about that this is the most important health issue the whole world is grappling right now, and the world's I must say the world's most biggest killer disease, right? So as I already mentioned, as I already discussed the symptoms of the diabetes, that include weight loss, and increased hunger. I talked about these conditions earlier in the previous video lecture, right? So we'll say that what are the signs and symptoms. Important signs and symptoms are the weight loss. It also includes the increased hunger. It also includes the increased hunger, all right, increased thirst. You got my point? Increased hunger, increased thirst, or increased urination. You got increased. Other symptoms are also present there, but if we talk of the other symptoms, symptoms may include, although they are not the specific to this disease, they are like blurred vision, fatigue, slow healing of wounds or slow healing of cuts, itchy skin, and much more. So this was regarding the signs and symptoms of this very particular disease. Now we'll move to the last section of this lecture, that's prevention. How we can prevent this disease, what are the preventive measures. As you might also know, also the things like there is no such known preventive measure, known preventive treatment for type 1 diabetes, because we talked about how the type 1 diabetes occurs and how the type 2 and how the gestational diabetes occurs, and we came to the conclusion there that type 1 diabetes, it's a kind of genetic disorder. So when we say genetic disorder, that means there is an issue with our immune system, there is an issue with our genetic makeup of our body, and we talked that kind of genetic issue. We said that this disease type 1 diabetes, it occurs in our body due to some autoimmune disorder, which is an issue with our immune system, with our body's defense mechanism. So we said that this is a kind of genetic disorder. That's why we say that there is no such known preventive measure for type 1 diabetes, because it's caused by a problem with the immune system, with the defense mechanism of our body, right? However, if we talk of type 2 diabetes, which is more prevalent, which is more common, and can often be prevented or delayed by maintaining the healthy lifestyle. That's very important. Like what kind of healthy lifestyle? Like making simple adjustments to our diet, to our fitness routine. We should get at least 1 hour aerobic exercise. Like we should go for walking. We should opt the cycling, the most important thing, and we should cut saturated fats out of our diet. Instead, we should switch to fruits. We should switch to vegetables, whole grains, the foods which contain high amount of fiber. We must opt that kind of foods, right? So also we should limiting sugary beverages and eating less source of saturated fat can also helpful in preventing diabetes, right? The most important things I must mention here, the most important, maintaining normal body weight, that's very important, and giving up smoking can also be an important preventive measure as well, right? So this was all about the diabetes and the types of the diabetes, signs and symptoms and preventive measures. And also we came here, we can also, if we draw an analogy between the two types of diabetes, we said that type 1 diabetes, it's very harmful type of diabetes, and there is no such treatment because it's a kind of genetic disorder. And how about what about type 2 diabetes? This is that type 2 diabetes, this is a disturbance with our lifestyle. So if we change our lifestyle, we'll make some simple adjustment in our diet, in our lifestyle, we can prevent the type 2 diabetes, right? And we came across the signs and symptoms of this disease, we came across the preventive measures, right? So lastly, if we see, if we talk about some important kinds of 2-3 foods we must switch to, we must take in our diet in order to control the blood sugar level, in our body. All right, we should, if we talk about those foods we should eat, we should go for the ginger. There's a most important spice we should add in our diet. This ginger, that's very important because it contains different kinds of secondary metabolites which will help in regulating overall blood sugar level. We should go for, you might have heard the name neem. Neem is also an important. All right, we should we should also take neem, we should also take cinnamon, and we should also take jamun. We should also take jamun. These are some important kinds of foods and spices we must go for, we should take along with our diet in order to control, in order to regulate the blood sugar level. Thank you very much.